If you are in the last stages of pregnancy, you may be wondering what are the natural ways to induce labor. Whether you are looking for at-home or hospital induction, this video will give you all the methods you need to get ready for labor and delivery. In this video, you'll learn powerful and effective natural ways to induce labor that you can do at home and in the hospital. Start getting ready for your little one now. Here are 6 natural ways to induce labor. I recommend that you first get your doctor's permission before trying any of these methods as a way to induce labor. Walking and exercise often make it to the top of the list of things to try. While there's no research that says it will induce labor, 30 minutes of moderate exercise at least 5 times a week can be helpful in any stage of pregnancy. And it's safe to use a birthing or exercise ball to stretch and help relieve some of the pressure in your pelvis, hips, and back. Staying fit can help improve sleep and your mood. It can also decrease your risk of cesarean delivery and gestational diabetes. Spicy foods can make you sweat, but they won't induce labor. That's an old wives' tale. Research has shown that eating spicy food can trigger heartburn and indigestion, but as for labor, there has been no documented research to prove this theory. Theoretically, there are multiple reasons why having sex could induce labor. For example, sexual activity, especially having an orgasm, can release oxytocin, which may help jumpstart uterine contractions. Also, for pregnant people who have sex with men, there are prostaglandin hormones in semen that might help ripen the cervix. Having sex is safe during the final weeks of pregnancy, but you shouldn't have sex after your water has broken. Doing so can increase your risk for infection. Stimulating your nipples can cause your uterus to contract and may bring about labor. Nipple stimulations stimulate oxytocin production. Oxytocin is the hormone that causes the uterus to contract and the breast to eject milk. Solid research shows that breast stimulation can be an effective way to induce and augment labor, avoid a medical induction, and reduce rates of postpartum hemorrhage. Using acupuncture, acupressure, or massage to induce labor is somewhat controversial. The belief is that stimulating certain pressure points in the body can release oxytocin and induce labor. While the effectiveness of this method is still up for debate, a foot massage is still enjoyable, especially at the end of pregnancy. And massage therapy can help treat the hip, back, ligament, and musculoskeletal pain you might feel while pregnant. Both are very safe as long as the care professional has experience in taking care of pregnant women. Some research shows that eating dates in the final weeks of pregnancy increases cervical ripening and cervical dilation at the start of labor and decreases the need for Pitocin use during labor. Before trying anything that might induce labor, speak with your healthcare provider to go over any risks or possible complications. Though some of these methods are popular folklore among pregnant women, little scientific evidence supports their efficacy. In most cases, it's best to let baby set their own birth date, even if it means waiting another week or 2.